Good afternoon, everyone, and mabuhay. I'm Dr. Romel Rivera from Philadelphia and President of the Association of Philippine Physicians in America, one of the organizers of the Filipino-American Health Forum on COVID-19. Before I proceed, I want to acknowledge the presence of our Consul General in New York, who will say a few words shortly. Today, as part of our ongoing webinars on COVID-19, we present to you series number 7, Frontliners. It was reported that an estimated 4%, or about 1,500 nurses in the United States, are Filipino. But in some regions, they account for a much larger share of caregivers. For example, in California, nearly 20% of registered nurses are Filipinos. It has been headlined lately that the nursing ranks are filled with Filipino Americans. The pandemic is taking an overwhelming toll on them. So the organizers of the Filipino American Health Forum invited 3 nurse frontliners, Rachelle, Janet, and Victoria. Our hope is that their stories, their sacrifices, their joys, and their sorrows may not be forgotten, and they should make us all proud of the excellent TLC, the tender, loving care, that our Filipino nurses are famous for worldwide. I will be your host today, and at this time, I call on my co-organizers to say a few words. First, Dr. Marie Ortiz, President of PNA New York. Marie.
Good afternoon, everyone. Thank you, Dr. Romel Rivera. I'm Dr. Marie Ortiz, President of the Philippine Nurses Association of New York. The organization strives to promote the image and foster the welfare of Filipino American nurses in the state of New York through working towards the professional development of nurses, such as participation in research. The organization collaborates with other professional organizations to develop and assist in projects that promote health and wellness of communities, such as the All of Us research initiated by the National Institute of Health. The All of Us research is a historic effort to gather data from 1 million people in the United States for the purpose of precision medicine. You may know more about it from its website, allofus.org. Today's forum, you will hear the voices of Filipino American nurses as they share their experiences in delivery of care to patients afflicted with COVID-19. Their personal experiences will demonstrate their true commitment to the nursing profession, the compassion and caring that are inherent in all nurses as they attend to their patients' health needs. It is an honor now to present to you one of the organizers, Dr. Emerson Ia, Chair of Kalusugan Coalition. Dr. Ia?
Thank you, Dr. Ortiz. My name is Emerson Ia. I'm the Chair of Kalusugan Coalition, a community-based organization dedicated to advancing health and well-being of Filipinos in New York metropolitan area. Kalusugan is pleased to be a co-host and a co-organizer of this truly collaborative effort with a primary goal to educate and empower the Filipino community. This week, we focus on the Filipino frontliner registered nurses. We will hear from our heroes, how is it like to come face to face with this disease. Filipino Americans constitute 16% of the immigrant healthcare workforce in this country. That translates to about 350,000 Filipinos. 40%, or about 140,000, are registered nurses. Filipinos are 4 times more likely to be nurses than any other ethnic group in the United States. In New York, where KC, Kalusugan Coalition, is based, 30% of Filipinos living in the state work in the healthcare industry. Tomorrow, the first Sunday in June, is supposed to be the day when we celebrate the Philippine Independence Day Parade here in New York City, and would have been the day that we celebrate our Filipino frontliner heroes. This health forum is our way of thanking the frontliners and celebrating them. We thank you, our audience in the US and across the globe, for your participation, and we look forward to your questions to our panelists and comments during our Q&A session. It is now my pleasure to introduce Dr. Laura Garcia, the Chair of the National Federation of Filipino American Associations, NAFA, the New York chapter.
Thank you, Dr. Iya. Hi, my name is Laura Garcia. I am the chair for the National Federation of Filipino American Associations of New York. NAFA's mission is to promote the welfare and well-being of Filipino Americans throughout the United States by amplifying their voices, advocating on their behalf, and providing resources to facilitate their empowerment. Our Philam frontliners are empowered groups and have been fearless in their convictions to help save lives. Today's Health Forum, we will hear from some of their stories of courage, commitment, and unwavering faith. So welcome to the 7th series of the Philam Health Forum. Now I'd like to introduce Dr. Angelica Razon, who is the committee co-chair of the Council for Young Filipino American Physicians of APPA.
Hi, thank you. My name is Angelica Razon, and I am one of the co-chairs for the Council for Young Filipino American Physicians. As a part of APPA, CFAP's vision is to amplify the voices of our members, patients, and community, and inspire every Filipino American medical student, trainee, and physician to be an effective change agent in the community's most pressing health priorities.
I am again honored and privileged to present to you the Consul General of the Philippine Consulate General in New York, Ambassador Claro Cristobal, who is a great supporter and a partner of the Philippine American Health Forum. The Philippine Consulate General in New York shares this series live through the Consulate's Facebook page. Please share their page. Without further ado, I present to you Ambassador Cristobal.
Thank you very much, Dr. Rivera. Once again, I would like only to give our thanks and great appreciation to all the partners in the Filipino American Health Forum series. The organizations of our doctors and nurses, as well as NAFA, have been very, very instrumental in bringing up to date our people here in the US and everywhere else in the world on the burning issues surrounding this pandemic. In the past 7 days, we've been a bit lucky. Only one reported case, fatality, was reported in our region. It's a grim fact, and it is a very sad one. Fortunately, in the past 3 weeks, we have no additional frontliner, nurses, doctors, hospital administrators, pharmacies, physical therapists among the ranks of Filipino American healthcare workers who succumbed to the virus. We still have 40 such heroes in the 10 states of the U.S. Northeast. We salute each one of them, and we continue to be so very happy that we have 3 of those frontliners to give us their experiences and share with us their knowledge of how this pandemic has impacted the cities, the hospitals they've been working in, as well as the Filipino American community located near them. Welcome, and thank you so much for the great work you are sharing with our community.
Thank you, Ambassador. I now call on Dr. Angelica Razon to give us some medical disclaimers and housekeeping rules. Dr. Razon.
Hi, thank you. I just wanted to go over a couple housekeeping items to help frame the rest of our discussion. Our goal for this series is to build community and share information. If you or a loved one is having a specific medical concern, please seek attention from your healthcare provider. This is an evolving phenomenon, and every locality situation is different. Please refer to cdc.gov, coronavirus.gov, and your local public health department for the most up-to-date information. The opinions and perspectives that are being shared today on today's webinar do not necessarily reflect the perspectives, opinions, or policies of any specific institution or employer. Again, we are simply here to share our experiences. Thank you so much, and I'll now give the microphone back to Dr. Rivera to continue the rest of our program.
All right, thank you. And now for the highlight of today's webinar, I now call on Dr. Marie Ortaliz to introduce our presenters. Dr. Marie.
Thank you, Dr. Rivera. It is my pleasure to introduce the frontliners. First, the first speaker, we have Rachelle Yaris, BSNRN. She's a frontliner from Bronx, New York. Previously worked at a skilled nursing facility, med-surg unit in a city hospital and emergency room in the Bronx. She currently is working in a critical care hospital, ICU in the city, working with COVID-19 patients since the start of the pandemic. Rachelle joined PNA New York as a member in 2020. Our second speaker is going to be Janet Mary Rodriguez Cuaycong, MS, BSNRN, CRRN. Janet is currently a nurse manager at Mount Sinai West Telemetry and Inpatient Rehabilitation. Janet's previous experience include Director of Quality Management, MDS and Admissions, Associate Director of Ambulatory Care, and Director of Nursing of the Skilled Nursing Facility. She has also worked as Senior Nurse Clinician at NYU Langone Medical Center, Rusk Institute of Rehabilitation Medicine. Janet joined PNA New York in 2012 and is currently an executive board member. Our next speaker, our third speaker, is Victoria Adina Pike, MS, MSN, RN, BC, CPHQ. She is a registered nurse with combined clinical and administrative experience of 40 years that include medical, surgical, OR, ER, neuro ICU. She currently is employed as the Assistant Director of Quality of Nursing at Tewksbury Hospital, Department of Public Health in Massachusetts. She holds certifications in pain management and public health care quality. Victoria is currently the president of PNA New England and is the PNAA Circle of Presidents regional representative of the Eastern region. Welcome, frontliners.
So let me take you back. So everything that I'm going to share is from my personal experience as a frontliner. So let me take you back to March, where all of this began. So I admit I was one of those nurses. I'm young, and you know what they say about millennial nurses? They say they're cocky, they're young. I admit I'm one of those. When I first heard about COVID-19, and all the reports were that, oh, COVID just affects the old and the frail. So I was one of them saying, I'm not going to have it. It's fine. I had flu patients cough up my face. I didn't get it. TB patients, I didn't get it. H1N1, I didn't get it. So I think I'm going to be okay. But then one of the first patients we had in our hospital was COVID-19 positive. I admitted her. So it's the ICU that I work at. So you know she's not going to be stable. And once they were wheeling her in, she's 27 years old, no past medical history, no recent travels. She's Asian. So looking at her, that could be me. And I'm always going to be thankful for having her as a patient at the start of this. Because of that, I took everything seriously. And from that day on, I worked at a cardiac ICU, and it just became a COVID ICU. All of our patients were on ventilators. All of our patients are asleep. They're sedated. They're medically sedated, medically paralyzed. So once you have a patient who's presented like that, you become their eyes, their ears. You become their family. And that's what the frontliners were doing during this whole pandemic. We're our patient's family. We're the connection between the patient and their family members because no visitors were allowed. And I mean, it's a known national shortage of PPEs. That's one, and that's one problem that we faced. So, but it's different when you hear in the hospital whenever you work that probably by next week ventilators are going to be short. Probably next week body bags are going to be short. That's how serious everything was. And I can say that this is one of the hardest part of my career, working in this pandemic, because it just not affect you and what you're doing. It just doesn't affect you physically. Like you go to your unit and then you see your coworkers, they're not there. They've called in sick, not because they're also getting the virus, and also because their family has it. So you're working the load of 2 nurses. So that makes the physical demands higher. And you also need to work on emotionally, because you're the family members of your patients. Like I had a patient whose family member kept calling every 2 hours, and it was fine for me, it was okay. And then she kept saying, oh, I saw this on the news. Is my mother taking this? I saw this in the news. I researched about it. Should my mother be prone? She should be on her belly. And me on the other end, I would say, yes, she's taking that medication. Yes, we've already proned her. But on the back of my mind, I know that I'm going to tell her, but she's not doing okay. The patient's not doing okay. Your mom's not doing okay. And it's not just one patient that you do that to. I also had another patient who was waking up even though he's on a ventilator, and he was saying, wife, I love you, call her. And when your patient is on a ventilator, eventually you'd think, oh, I'm sorry, I got to put you back to sleep because I don't want you to be coughing out. I don't want you to hurt yourself. But I will call your wife. I will let her know your message. So I put him back to sleep and I called the wife. And when I called the wife, she was just crying on the other end of the phone, saying thank you for giving that message. And if her husband wakes up again, let him know that their kids are doing fine. My patient, the husband never woke up. The next week he died. And that's what happened for March, April, and May. Most of our patients, like for this day, I'd have a patient who's crashing. For the next day, I'm wrapping out a body. For the next week, I'm wrapping another patient's body. It hits you differently when you hear that that you're gonna run out of all the body bags already, because you know that everyone's dying. And it's not supposed to be like that. We're out there to save lives. We're not out there to just be wrapping bodies just to make sure all of their bodies are labeled. That's not it. But during this whole pandemic, we become someone else's family. And you're exposed so much to this virus, that you're also concerned that you don't want to give it to your family and friends. So we go home and we isolate ourselves, only to make sure that we're okay to go back to work again, and then isolate ourselves again, and make sure that we're mentally and emotionally stable so we can do it all over again. And we're never sure when this pandemic is going to be over. There was even a time when I went home and I can still hear the alarms of the hospital. You can still hear the ventilator alarming, the IV pumps alarming, the sled machine, the dialysis machine alarming. And personally, I could not get any sleep. I tried Benadryl, it just made me groggy, I was still awake. I tried the machine that they use for babies so they can sleep better. I tried that. I was hearing that white noise from the minute it started till the minute that I had to wake up. So sleep was really something that is hard to get when you're working in this crisis. And one thing that really helped me cope was talking to family members on the phone, FaceTiming them, and also talking to my coworkers. And one thing that I'm really appreciative of the hospital that I work in is that they gave out a hotline, an emotional support hotline that you can call whenever you're feeling like you're anxious enough to work, or whenever you're off work and you're still feeling the anxiety of working in the pandemic. This is really a really hard time and a tough time, not just for me, not just for the patients, but for everyone. It's like we're battling something that we cannot see. And for other people, they say that us healthcare workers, we're good because we still have our jobs. It's true, but we're exposing ourselves too much. And I know that people who don't work in the healthcare system, they're also quarantined, they don't have any jobs. So no one's really winning this battle that we have. And if you have to ask, if you're gonna ask me, how does it feel like to be working in this pandemic? It feels like it feels like you're holding your breath. And you never really know how long you've been trying to hold your breath until you see one of your patients get extubated, and then you breathe. You talk to their patient's family members, saying that their family is okay, and then you breathe again. Until you talk to your own family, friends, and then you find out that they're good, they don't have COVID, and then you breathe better. And then you hear people outside clapping, appreciating the work that you do, your Filipino community thanking you that we know that you're outside of the country and then you're working, you're doing hard for serving a country that's not your own, then you breathe more. And the battle's not over. COVID is still out there. And we just need to be with each other like this. We're sharing experiences. This is a way of verbalizing what's happening, and it makes us breathe better and again. And hopefully a second wave doesn't come. And that's my experience.
Thank you.
My name is Janet Cuaycong, and currently I'm a nurse manager. And as you hear what Rachel had shared, her experience, me too has a personal connection with COVID-19 because I'm a survivor. And I'm proud to be a frontliner and a survivor for COVID-19. As a nurse manager, there is a lot of things that responsibilities on day to day. When the first word came, COVID-19 patients coming to our unit, there was a lot of dilemma between my staff, refusing, fear, anxiety, and you need to gather your thoughts and how can you help them better. What I did personally is to ensure to give them support, is to call on my directors and making sure that we provide them with enough information. One thing that was really very important is listening to their concerns, listening to their issues, making sure that each of those issues were addressed. I called on to my director, my chief nurse, and even the director of infection control. After that, we actually ensure that we have availability of our supplies. Competency are being reviewed regarding the donning, gloving, gowning, donning, doffing of our PPEs. We have even to the minor detail of making sure that the availability of our supplies and how do we orchestrate when patients are being transferred to from the unit going to the main ICU so that there will be no exposure to other patients. So we kind of like drill down on those issues, and dealing with it is kind of coming from being sick and coming back to work and not knowing how much staff I will have, and dealing with other people that had issues such as being deployed to my unit. They're also at loss. So when to navigate the system or issues and how to give them details on how they can work on the day-to-day is kind of daunting in terms of really supporting them. I could see my nurses in and out in the our COVID areas where we are converting our converting our own 4-bedded RE2 unit to become our negative pressure unit, wherein we, time and again, patients are very, very sick, and wanting when I turn my back, just fixing and helping my nurse to reposition a patient. And when you come out from that room, in like a span of 5 minutes, we're calling a code. And when you turn around, you could see one after the other. So it's kind of like the feelings that I have at that moment is just like, how how I'm going to deal my own grief for those patients, and also how can I support with my nurses. My nurses are very brave. I know inside them they're very kind of like having anxious, but believe me, when these nurses, when they're confronted with a patient, they're very, very focused. There were patients that actually have been wanting to speak to their loved ones when they get better, or they come out from ICU and they want to speak with their loved ones. And we have to facilitate that so that they put a connection. There's also family members who constantly wanted to speak to them. And how can we provide that moment of privacy, support, and making connection. And then the following day, the patient is gone. So you really don't know what could happen 5 minutes later, 10 minutes later, or it's just a matter of few hours. So staff coming in, not just burdened with all their personal issues on how can they take care of themselves, but also how they're going to take care of their family when they go home. Some of them cannot really cope with the situation, angry with all the situation, have to hide in their basement or their attic so that they could be quarantined away from their family, so that they could continue to come back to work. So these are very tough times for our nurses. There are nurses that are quarantined because they are exposed to possible exposure, or they are sick themselves. And my phones are blowing up every single minute. You have staff crying and telling you exactly how they feel. They can't breathe. They need a doctor, but their PCP is out of town, or they're also in quarantine and they could not reach anyone to give them support or give them an advice. So I become a support to them and give them referrals, how to access our employee health services, how to access information on how to help themselves. Every day I come and there's always an issue, someone coming to you crying about their loved ones, their family members. So you give them enough information, and you also focus and supportive to them and how they feel. And every day, even just the few people that you have, because some of your half of 50% of my staff is out, and people that are helping me, I'm just trying to give thanks to those people who had supported us. One thing that I really could not forget is that there was a daughter, one of the patient's daughter, who called from Thailand, who had lost her father actually a month ago, and now facing to hear that she lost another parent. And being away, very, very far away, it's a lot of financial burden, a lot of even talking and said, how can we take the body? We don't have anybody in the States. How much do you think they're gonna? So they ask you all this question. I even have to give my personal messenger so that they could connect with me to give them information, because there's no way that they're gonna have incur additional expenses for long distance. I have to resort to find some research information for them, so that to just provide them with peace, that they could connect with a public cemetery or to our patient relation or social worker who could work with them. And they're around the world, in Thailand and different time zone, worried, crying, and worried about that who's going to take care of the body. So it's just so much emotion that you, as a nurse manager, you're not only talking about the patient, you're not talking about the family, you're also thinking about the staff. We do facilitate a lot of training in the very beginning, but that's not even enough, because when you're confronted with COVID patients, whatever, even you stay focused, people had an anxiety. So I have another staff member who came into the COVID room who can't breathe, but he's thinking about the breathing support group that we have, and eventually overcome this nervousness and anxiety, and little by little is able to take on that N95 and take care of that patients. So, I mean, in reality, it's this pandemic that really changed my perspective being a nurse, as a nurse manager or as a nurse leader, is that it's just like you don't know what will happen tomorrow. You don't know that we could cope, but you have also to listen to yourself and say to know when to stop and just listen and take care of yourself. There's a lot of people out there. There's a lot of support groups that we can go to. I provided my staff with a daily briefing that every day it will be better, that slowly that we can breathe and be able to, and just continue to support them. We have a weekly healing, group healing meetings so that they could start to share their feelings. I'm very fortunate that where I am working right now is that they have a very good support group. Mental health and behavioral health has been helping us go through this, and my staff was very grateful for the one-to-one discussion. Privately, were able to express themselves and slowly able to heal. But it's very tough. But we're just hoping that we continue to heal as a group, and by giving this platform, providing them that they are not alone. There are also the same stories that they have, and that they could each other able to go through this without any more feelings of doubts and fears and anxiety. And I'm really glad that I'm able to share my story. And as a nurse who had lost a good friend, and in the name of my friend, that my assistant, I've learned so much, the value of life and the value of the people that's around you and support you, your family, your friends. We could always reach out for each other. Thank you.
My name is Victoria. I am a registered nurse with 40 years of experience in a multicultural healthcare system and different areas of expertise in nursing. Currently, with my role as an assistant director of nursing, I am hands-on and visibly involved with the clinical aspects as well as the administrative aspects of my job. This makes my job very rewarding and a great experience daily. The pandemic COVID-19 was an eye-opening experience, scary at times, but I am a nurse with the right skills, abilities, and knowledge. I felt challenged to respond to the call of duty so that when my supervisor called on Easter Sunday that the units were short-staffed, I left my turkey dinner in the oven and with my 17-year-old son managing the kitchen affairs, off I went to work. As Filipino nurses, you know, we're always ready, and that's our calling, not only calling, but also our vocation. So I was mentally preparing what would be happening in my hospital, knowing that COVID-19 was here. We started preparing months prior to our first case, before our first case was identified, and there were a lot of discussions, a lot of meetings were happening. But as with any organization, the issue of PPE was present. We had collaboratively troubleshoot areas as issues arose, as well as prepare our mindset that this crisis is imminent, and in fact, it is here. My facility was responsive in allocating resources appropriately. In the peak of the pandemic, we were lucky to have support of the National Guard, who helped us with testing, donning and doffing, and social distancing. I got tested for COVID-19 immediately after, a week passed, and I was not feeling really that well. I got tested positive with moderately mild symptoms, and I was grateful that I did not get hospitalized. 3 days from that, my husband was also having symptoms. Then my daughter also was having symptoms, and both tested positive. So there were 3 of us in a household. There was a point that The cough was severely dry and persistent and caused chest pains, and no amount of warm showers and steam inhalations and hydration steps were abating it. I had to call my PCP and begged for prescription to alleviate my cough. They were not in the mood to prescribe actually antibiotics, because obviously COVID-19 is viral infection. But there were a lot of help for us. I mean, personally for me, I'm a very spiritual person, so I engaged myself in spiritual readings, faith and prayer, engaging in dynamic Christian group reflections. I did a lot of meditation and mindfulness. I love music, so I played my guitar and sang songs in my own room by myself. Did a lot of drawings and, you know, all the stuff that you can think of, so that you can just help yourself also at the time of a quarantine and to maintain isolation. Physically, of course, we resort back to eating a balanced diet. I would put my plate very colorful with all the fruits, even though I did not have the sense of taste or smell. I also emotionally was calling and being supported by other colleagues who had been affected by COVID-19. Then one night I had a call from a friend, and I said, who was also affected by COVID-19. And I asked her, I said, how are you doing? And she said, Vicky, I want to die. And my heart just broke. And I just said, wow, I have to do something for this friend of mine. So we started a group of actually calling each other, supporting each other, checking each other at a certain time. Then I started putting a telephone tree that all of us were sending cards to one another. Then through my organization, the Philippine Nurses Association of New England, we had mobilized actually help through homemade mask distribution to its members. And also we did distribution of masks to the homeless, which we always volunteer to the Pine Street Inn. And also our neighbors, helping neighbors. We actually dropped care packages, food aids, and anybody that we knew that was affected by COVID, we left on their doors and just called them and then left. We did not even have to see them face to face, because we were conscious about social distancing, masking, and all of those things. So I think that COVID-19 made me a very strong person, more so a very strong nurse. I was wondering when I was doing my meditation, why after 40 years I would get COVID-19. I've never been sick in my whole lifetime, luckily. But, you know, there is always a reason why I think you are put in such predicament. So one of them would be that it has changed my perspective in life, and that all of the decorations we have, personally and professionally, all of our positions, titles, possessions, are just that, stuff. And the realization that faith, family, and friends is very reassuring when you have values. And that has remained very important to me at this point in time. Life has taken a second lease because there were three of us. In one night, I was talking actually to my husband. We assigned ourselves in one part of the corner of the house, another was at the bottom, you know, at the basement, and of course my daughter has her own room. And there's one time that we had asked, if we all three died, what would have happened to our other sons, you know, the four sons? It was a stark awakening. But then, you know, my son, he goes into, I think, copes with humor. He just said that, you know, well, we were together for a long time in health, and now this is what's it's called in sickness. So we kind of laughed about it, and moved on to the next day. But as terrible as it sounds, really, COVID-19 might just be the crucible that forges a new version of nursing. Struggling with a lot of issues can lead us to positive transformation. And I think we as Filipino nurses who are in the front lines is lucky and blessed to have these kinds of forums, sort of a debriefing, which makes us actually go through our feelings. Because when I went back to work, and thankfully I'm going back to work now strong, a colleague of mine who is a psychologist, when she asked me, how are you doing? I looked at her and I said, I wasn't sure. I'm doing great, I told her in the beginning, but I said, I'm not sure. And then in her own kind way said, let's talk about it. And that opened up, bringing up all our experiences, what we should do, what kind of support systems we have, which we had a lot actually. And that is just, it is heartwarming when you have that kind of a support. I wonder if all of our Filipino nurses have that kind of a support, because in their faces, I could see anxiety, I could see fear, I could see they're all scared. Even when I was sick, I was getting calls from home about the confusion that they felt, the chaos that was happening, processing it was very hard, and death was very hard to accept. Especially our, patients, we love them so much. I had a patient that succumbed to COVID-19, who was my very first patient 30 years ago when I came to the hospital. And that was sad. So a lot of things, I think, are accomplished when we help one another, especially like this kinds of a forum. And who knows, imagine through COVID-19, we are able to bring out better work environments. We are giving a lot more respect to one another as nurses. We are imagining that due to infection control and containment, we nurses can now have a real break, a real lunch break, because nobody can bother us because we have to don and doff. So we have to have a break that nobody is interrupting us. And also, I think we should be promoting self-help and team collaboration, because this is all what's going to happen again if a second surge come up, and I pray it doesn't. But I hope that as nurses, the COVID-19 has made us strong, because we Filipino nurses are hardworking and we are resilient. And I believe we can all do this together fruitfully and productively. Thank you.
Experience, a touching experience. Dr. Romel?
Well, thank you very much, Rachelle, Janet, and Victoria. Those are very moving experiences. Thank you for sharing. You're the shining examples of Philippine nursing excellence. Thank you so much. So we now go to the question and answer section. I think Marie has a question.
Yes. My question is for Rachelle. Rachelle, what gave you the courage to face the challenges of your work on a daily basis in the ICU?
So I entered nursing because we're a family of nurses, and whenever you work, not just for this pandemic, you're working for the patients, and I love working with people. So whether it be a simple cough or cold, or whether I'm here in the ICU and this pandemic happened, it never made me leave and say, oh, this is too much. But this is my calling, and I love working with people, even though it's a more severe disease that I know that I'm gonna get. And just knowing that, like I said, like what I said earlier, with this pandemic, it made me be someone else's family. That alone makes me do it again and again, because I know how for us Filipinos, family is important, and that's what I was during this whole pandemic, and that's what I'm gonna be continuing to doing. Hopefully, a second wave's not gonna come.
Thank you, Rachel. From one Filipino nurse to another, you are truly a nurse.
Thank you.
Dr.
Thank you.
Romel?
Oh, I think Emerson has a question. Dr. Emerson.
Well, first of all, thank you so much. I'm speechless, actually, and coming from all of you, your personal experiences, and I said earlier at the beginning of the talk that you faced death, you faced COVID. You look at it in the eye, and you did splendidly in your efforts to really take care of patients. So my question relates to everyone's experiences. I know Victoria alluded to this earlier in her talk about the role that our culture plays in being resilient and managing, COVID-19 and the mental health that comes with it. So this question is really for Janet. If you can share and maybe identify how our Filipino culture played a role in coping with COVID-19.
Well, let me begin by saying that we Filipinos are really, really like the homebody. So everybody goes to us. Everybody, we take care like we are mothers. We take care of everybody. I remember when I was home and when I was in quarantine, I have to call every single one of my employees that are under my care. And mind you, I have 100 direct reports. And with that, if you have 70% of them are in and out, one is out sick and the other out sick after a week or two, you have to make sure that you take care of each one of them. And it's not easy because you should be an active listener. You're not just listening and give them advice, but you're really just being there as a support person. As I've said, like the mothering, the culturally, like when you say mothering, is that you take them all and you just one by one. I don't know how I did it, but I just did it one after the other, after the other. I made masks, surgical masks for them. I made a surgical cups for them. I think I'm also dealing with my grief, but I'm also providing them something I have. If I could not cook for them, I've made something out of my hands that I'm doing it, labor with love, that I'm there supporting them. And I think the whole pandemic, that's how I carried through. And I'm just happy to say that we're in a process of healing. We're not there yet, but we are going to be okay.
Thank you, Janet. And I think Laura has a question. Dr. Laura.
Yes, thank you, Dr. Romel, and thank you all. My God, these gives me goosebumps. These are really great cuento or kwentuhan or conversations. One of the admirable traits of Filipinos and Filipino Americans is that we are open to conversations like tragedy and comedy, being together in sickness and in health, and facing life and death. One of the leaders in my alumni association brought up a great point when I sent an invite about our health forum. She reminded us to prepare a will and advance directives. As leaders or clinicians, we know this is very important, but some of our frontliners who died of COVID-19 did not have a will or advance directives, leaving their families or parents with nothing. Have you experienced this in your units? And anybody can answer this, or your areas or your nursing groups. And how did you or your groups deal with this unfortunate event?
Victoria?
Yes, I could answer that because I have personally, I have an experience prior to COVID, because, you know, we are in the age of almost going to retire. We're not planning, you know, yet. I always look at the Filipinos as not preparing, even though we are always looking towards the future, but not preparing like that for emergencies. When one of my nurse managers, who is also Filipino, called me and was very desperate about being sick, not having the grandkids there, being isolated, nobody to talk to. We started talking about, are you ready? And I said, in 3 aspects, are you ready actually? Number 1, spiritually. Number 2, mentally. And number 3, financially. So we had great discussions on spiritual aspects because she's a believer and we have always supported each other. For a lot of us, our Filipinos are very, very religious. Mentally, she said she has a lot of support systems. We gathered our strengths together by, self-checking one another at a designated time. But when we started talking about financially, and I started asking questions about, you have your grandkids and you take care of them, do you have a will? He goes, no. And I said, do you have your papers in order? Have you designated, if something happens truly, who is the healthcare proxy? Since you are my friend, I need to know. And because you don't, is single mother. And I said, I need to know so that, when affairs are going to be straightened. So that prompted a good amount of conversation. She actually started crying because, it's very stark when you are faced, and she was really, truly, truly sick. That there was one night when she called that I kind of was battling between sending an ambulance to send her to the emergency room. But because she said, I'll manage it, I'll call you if I truly, truly can't handle this, I'll admit myself, via 911. And I said, okay. But then the good result of that was that today she has already met with, a lawyer, and her affairs are in order. It was very funny when we were doing it because I was asking her, okay, you have a lot of jewelry. We women, the Filipinos, have a lot of jewelry. So I said, okay, who is it going to? So she started actually going into her drawers and started organizing her jewelries, and started naming them for her grandkids. So I think he has all things organized. She has trustees. She established trust funds for the kids. There are 3 grandkids, and named all of the jewelry to the 2 females. We make a joke out of it today, and but I think we Filipinos should really, really do that. And then I went through the 5 wishes. That paper. We have research papers about the 5 wishes, and then we had to go through it, even though we did it as an education before. I did a lot of in-services on 5 wishes. But did I personally do that? No. So when I checked her, did you do that? Because I had so much education and you did not even do that. So everything now is in place for her. And now she had also taught another group, her own group of registered nurses are starting to look at the 5 wishes and then building trust and really fixing their finances, in order, which was, to me, a good result of having been, if we were not COVID-19 positive, we would not have thought about that because, us Filipinos, we like to work always 16 hours, never thinking about what's going to happen, just fill in the blanks for our bank accounts and never looking back. But we needed to do that. And that's a good actual question.
Well, thank you. Dr. Razon, or do you have a question?
I do. Thank you again so much for taking the time to just honestly share all of your experiences. And there's so many great comments. I know you guys probably can't see them in the chat box. There's so many great comments about just appreciating your openness and your willingness to not even just share, just like speak your truth, which I think is like really powerful. I guess building off of Dr. Garcia's question, and something I had a hard time when I first started working in the hospital was, I think, coming from a certain cultural group of values or a certain spiritual background, we have certain ideas about life and death, essentially. And a lot of that has to do with our upbringing and where we're from and things like that. And all three of you have touched upon this, actually. Kind of, I'm curious, like what your cultural, your spiritual, your personal upbringing about life and death, and specifically when you're working with patients who might actually not share that, and like what are some things that you might have learned about yourselves, or about maybe our culture as like as a country, about kind of the value of life and death.
Janet, you want to answer that question?
So, when you're working in a group of different culture and different nurses, you will also have to understand that you cannot just instigate your own personal or your own, I'm a Catholic, that this is how you're going to. But what I did is that I integrated in my daily huddle, and I don't know how everybody had responded it positively. But when you're praying, you're not just praying. The group is praying in a way that you inclusive. It doesn't matter what kind of religion. So I made it a point to have to say thank you and talk about the challenges that we have, and a lot of them say that we're grateful to have that morning prayers to give them strength for the day, especially what they're facing it. And I become even more aware of myself on it's not just about being prayer, your everyday relationship of every single one that you met. The values that you had instilled in yourself and how you had shown and shared with your colleagues, very important. And I think it's being justified on what my staff had shown me lately, and being appreciative of me, and the love and the attention is because also of how you provide yourself. I think that's the most important. And I think when you put them, you bring them together, your spirituality, your own values, there will always be people around that will say something, but you slowly try to attract that forces, and sooner or later there's going to be like a beautiful union where it's very easy to manage. And believe me, I don't manage an easy bunch of people, and I think that's very important, and very important that every day you start your day or you end your day is just saying thank you and be able to share that, because it's beautiful at the end of the day.
Well, thank you very much, Janet, Victoria, and Rachel. On the Consulate's Facebook page, there are no questions, but all comments. I'll just read to you before we turn into the Consul General. So from Edwin Jose, thank you for your unselfish service. Jennifer Aying, I am proud of you, Rachelle, Janet, and Victoria, for representing all the nurses in the United States and beyond, and PNAA. Jojo Borja, thank you for providing people appropriate care and support during these difficult times. Mabuhay tayo. Kayo. Vivian Talambiras Cruz, we salute you for your selflessness and dedication. May the Lord bless and protect you. Susan Gador, congratulations to all my nurses colleagues. How are you and your institutions preparing for the second wave of it comes? Looks like a question, but I guess you already answered that. Joy Aureliano, thank you. Rachelle, Janet, and Vicky. Guts Roland Gatiliao, thank you. Rachelle, Janet, Vicky, your stories are inspiring. Well, thank you very much. For further, if you have other questions, please email us. It will be shared later on by Laura, the email address that you can share or ask your questions. But again, thank you. Now we go on with the program. We now have the Consul General's final remarks. Ambassador.
Thank you so much, Dr. Rivera. Well, you know, this is the 7th episode in the series. And but this is the first time that I fully understood everything the resource persons are talking about. I mean, epidemiology and pathogenesis are concepts that I half understand. And they were helpful because I ended up learning a bit here and there. But it was the mind, it was the brain that needed to tag along and understand those things. But our 3 resource persons today were tagging. Some were deeper, some were closer. It was Rachelle who raised the very first mention of that sobering fact about our situation right now. He said, we just don't know when this thing will be over. And Janet followed up very quickly, saying that we just don't know what tomorrow will look like. And of course, Vicky said it could be a second wave, and we don't know. We just don't know what comes next. Yet, the pain, the heart, the challenge, you have all seen, you have all experienced. There is one thing I pick up from today's session, and it is something that gives me confidence. And it is the fact that right there in the front lines, we have people. If nothing else can give us assurance, if nothing else can give us guarantees, I think it's the knowledge that we have frontliners who really care and who know what they're doing and who obviously love what they're doing. Nothing else can compare to that in giving us confidence. Thank you so very much. In the name of all Filipinos and Filipino Americans in this country. Thank you.
Thank you, Ambassador. I think there are some messages also at the chat box. Maybe you can read a few of them, Emerson, before we give the microphone to Marie and Laura. Just to give credit to those people who gave remarks. Emerson.
Yes. The first remark is from Gats G, who thanked you all for sharing your COVID-19 experiences, especially to Janet. Dr. Sagar did wonderful, touching sharing of frontline experiences. Many thanks to the presenters, Rachelle, Janet, and Victoria, and all the organizers. Lolit Compass saluted all our 3 presenters for sharing their experiences, speaking from the heart with grace, sincerity, and truly touching, and very proud. She's very proud of all of you, and you have made all Filipino American nurses very proud. And again, the last comment is from Gats, thanking Rachelle again, Janet, and Vicky for sharing your personal stories and realizations in the profession. You are all inspiring.
Well, thank you, Emerson. Now, Marie, for last words. Not last words, last remarks.
Thank you once again to Consul General Claro Cristobal and to my co-organizers, and most of all to our frontliners for sharing, showing us your courage, compassion, and caring, and for upholding the nursing code of ethics in all situations and in all times. Our next succeeding, for our viewers to know, our next succeeding forum is going to be on employee health and post-ICU syndrome. Thank you.
Thank you all for joining the 7th series of PhilAm Health Forum. You can also view our previous presentations on YouTube. Got feedback? We'd love to hear from you. Please send us your comments, suggestions, and how we can improve our forum, and most importantly, future topics that you would like to hear. And email us at phil.am.health.forum@gmail.com, and follow us at #PhilAmHealthCovid-19. Thank you, and see you next time. Be well and stay safe.
All right. Thank you again, everybody. Janet, Victoria, Rachelle, Ambassador, thank you again. See you next time. Thank you. Stay safe, stay healthy.